What's up, you guys? My name is Miguel, giving you that daily dose of radiation, and today we will be doing a video over the X-ray tech markers. How often are they used? Do you use them at all? How important are they? This is mainly for the students and those who are coming into the the field. Are curious about that, because as a student I remember the teachers would be like, put your marker, put that on everything, any picture you take, put it on it, make sure it's facing the right way, make sure this and that, everything. Oh, marker. You can get sued, everything is about the marker place. Sometimes I will see the students, I don't mean to be mean, like their position isn't good, but I remember putting the marker right, and I'd be like, Okay, so kinda, are you supposed to put the marker? Yes. Optimally, a perfect, complete image has, the picture next to it, left or right marker. That is, quote unquote, the perfect X-ray, the perfect technique in a walkie-talkie perfect world in our field. So, does that happen always? No. Can you? No. So, here are some instances that most likely you probably wouldn't use your marker, both for your safety and both for the patients, like to do the exam quicker, because it could, that 1 extra second, especially during like a trauma situation, could be you don't have time to do that, or if it accidentally, if when you angle something, and it, like, the marker is in the anatomy, you got to reshoot it. So, trauma situation, I really wouldn't even put a marker for traumas. I truly probably wouldn't, especially if you're doing the abdomen, hip, pelvis, because if it's in the way and it's like a life or death situation, you don't want to reshoot it. You don't want, like it's just better to do it post-processing during those situations, I would say. And also another one is, if you're doing an X-ray, let's say it's a hand or arm or something simple, or a head, anything, and there's like a bunch of blood, I know you can wipe it down, but I personally wouldn't put my marker there and have it blood, because you contact with it. Yes, you can clean it, but still, I really wouldn't put the marker in those situations either. Just as far, for a little germ action type deal. Let's see, what other situations? I like putting them a lot, like on ribs, because you're oblique, and then sometimes, especially if you're shooting it with a different partner who's in the back, and to make sure which side of rib is what, or you're oblique in what. I know if you know the anatomy, you'll be like, Miguel, you should know the anatomy, you should know if it's left or right. But sometimes you get busy and you're in a rush, and I'd rather it just put it there, have it already out of the way, make a little easier on the brother. And then for morning portables, the amount of chest X-rays will do, will vary, and because essentially once you shoot your morning ports, let's say it's 30-40, and you go in there and you gotta, all you're essentially just putting your nose, putting it on like that, just having to click the left. You already have the marker there. Will save you a bunch of time. I just stick mine on it. I'll show you all the technique I use to make it easier for those who have a grid. I'll show you in the future. That will save you time. I would recommend using it in that. And also, depending on your rads, how picky they are. Ours, they would like for us to use a marker, and it's mainly not because they want to mark, because they want to know who to blame if you take a shitty picture. That's the reality in our joint. They kind of want to know who to blame, or who, for the situation, because a lot of our day shifts are notorious for not marking stuff. So they are always pushing us to put our markers. I've always used my markers. I keep it on for all the chest x-rays, shoulders, ribs, hips, and pelvis. Sometimes I do, sometimes I don't, depending how big. Especially if it's a big patient, probably won't mark it, because I'm like, my marker would probably be in the way or something, or abdomens, probably won't mark it there, because especially if they're so wide, I don't want the marker to get in the way. So you kind of have to give your best judgment on that, per se. And let's see, what else? What other situations could you be using them? Or if they're contacts, patients, or have some kind of, disease, I wouldn't put it there, because, once again, yes, you can clean it, but then you'll still, you carry your markers close to you, and I wouldn't want, to risk the chance of, if you didn't clean it good now, you got sick because of it. It's kind of, iffy gray field type of deal. And you learn in school that you can tell if something was post-processed or not, or if you added it wrong. Then you have to be careful of not putting the wrong marker on it. You have to catch yourself on that, because sometimes you put the wrong marker, especially more as a student, or if you're in a rush. Or I would say if you're doing both knees or anything kind of bilateral, I would recommend putting your markers. So in case later on you're on the portable and you're pulling up the x-rays, you don't be like, oh, which one was this? Which was that? Was that left? Was that right? You don't get stuff confused, because that can make a difference between which knee they fix, or which shoulder, whichever they have to fix. That is another important one. Let's say, what other one? Usually in my hospital, which I work in a trauma theory center, if they're doing, what's it called? If something, let's say, is broken and they had to go back in and put a cast on it, most of the time I don't mark it, just because the fact, like, you just had to be quick, because they want you to shoot it. The doctor's probably holding on the board and like doing, cross table, doing all that kind of stuff. So if they're gonna cast that, I really wouldn't worry about marker. You're just trying to get the picture as best as you can. Most of the time you're doing kind of cross table, try to get them type of deal. So in those situations, I really wouldn't put a marker in. And yeah, I think that's all the situations I can think of at this moment. And yeah, it's been your boy Miguel. Hope you enjoy your daily dose of radiation. See you on the